So one of my patients the other day, I was asked to come and drain an abscess that he had. Most people get abscesses actually from IV drug use. And so when I went and investigated, sure enough, he had actually been a chronic opioid user and had taken a number of IV drugs. And he had had a number of abscesses already in his life. And this one that he came in for this time was in his right armpit. That's where he had decided to shoot himself with some drugs. Young kid, 26-year-old guy. And when I walk into the room and start talking with him, he's saying, things like, well, you just don't care about me, and you want me to be in pain, and that's why you won't give me more pain medications. Meanwhile, I had gone in there to try to discuss with him which pain medications we were going to use while I drained the abscess. But he was already on such a high dose of narcotics that no matter what I gave him, it was not going to help him based on all the stuff that he was on already. So I'm discussing this with him and trying to get somewhere, and he's going off. And all of a sudden, I feel myself starting to be triggered. All of my internal alarms are going off and saying, this is not working for me. So that's exactly what I said. I stopped him mid-sentence and I said, okay, you know what, this is not working for me. And I realized that why I was being triggered was because he was playing all the games that our kiddos play. He was triangulating, he was already interrupting me, he was playing the victim, he was exaggerating things. I decided that I would try some tricks on him. The same tricks that we try on our kids, I decided to try on this 26-year-old guy with an abscess in the hospital. And so I started just repeating myself over and over again when he would not answer my questions. So I was proposing that we use Ativan to help sedate him for the abscess drainage. So I said, would you at least be willing to try the Ativan? He did not want Ativan, he wanted more Dilaudid or morphine or whatever it was. And he said, oh, you just want me to be in pain. So I, again, just repeated myself over and over, kind of like what we do with our kids sometimes. I just calmly, with love in my eyes, said, are you at least willing to try the Ativan? I had to say that 6 times before he stopped and he looked at me and he's like, are you just going to keep repeating yourself? So I said, all right, finally, we've gotten somewhere with this guy. Here's this guy. Eventually did get the abscess drained. Don't worry, he's still in the hospital because he's very addicted to the drugs. But I thought, how sad. Here's a guy who could have had so much potential in life, still has a lot of time for potential in life, but because of the pain in his childhood that later I had a chance to talk with him about, he has had, and still has, so much pain inside that he has to knock himself out with drugs in order to somewhat function with that pain. And I was reminded that that's a common end result for kids who have trauma in their childhood and don't get the tools that we have been blessed with in order to help heal them from that pain. A very fascinating article came out a number of years ago by Dr. Bruce Perry down in Texas. And he is a phenomenal child psychiatrist, MD PhD, and he has started to look at this whole issue of attachment. And his area of expertise is looking at what he calls adverse childhood experiences and the effects of those on the children later on in life. And what he has found is he has linked any number of adverse childhood experiences, whether from trauma, whether from neglect, you name it, natural disasters, whatever types of adverse childhood experiences that cause stress in that child's life. And he looked downstream 20, 30 years later, where are those people? And it is strongly correlated from everything with alcohol abuse to personality disorders, including your antisocial personalities. Your borderline personalities had a very strong correlation. And included in this was homelessness and narcotic drug abusers. What I want to talk to you about in this first session is really about where it all begins. Where is it that these adverse childhood experiences, or where is it that the stress in a child's life begins to affect them where they will have a personality disorder, or they will have a tendency to become addicted to alcohol or drugs or whatever it is that helps them deal with their pain. And some people say, well, it's really all about genetics. The mom, the dad, whatever their genetics is, that's kind of naturally what the child will have, and their ability to respond to stress will really be based on their genetics. Well, they've looked at twins, biological twins, identical twins, who go through experiences and see that they respond differently. So it obviously can't be only genetics. So then they've looked at, well, it's entirely environment. Just the types of experiences that a child goes through, or the extent to which they were abused, or the types of neglect that they experienced, that will determine their predisposition to certain personality disorders or drug addictions. So they looked at that, but yet, as we know, looking at people who go through the exact same natural disaster, say, or sibling sets who were in the same home and got removed for whatever reason, those siblings, even though they were in the same environment, respond very differently. So it can't just be environment. So then we look at, well, what is it? And more research is coming out about what's called the womb effect, where even before you are born, you are in an environment that can be stressful or can provide security for you, can be helpful to your overall health and future, or it can be harmful to your overall health and future. And while it can sometimes be a little scary to think that, wow, so much can happen even before I'm born that I don't even have control over, more and more doctors are publishing all of the evidence of long-term complications of women who are experiencing some type of stress while they're pregnant. Say that the woman is being abused in an abusive relationship. Those children, even though they personally were never abused, still have the same predisposition as if they were already born and in that abusive environment. So we look at, well, why? How can that be? But yet, as we think about it, as a woman is pregnant with her child, all those hormones that she is producing because of her environment and genetics, a combination of both of them, all of those go to the baby. They go through the bloodstream, through the placenta, to the baby. And so if the mom is stressed and she's producing lots of cortisol, that baby is in this bath of cortisol that is having the same effects on the baby, the unborn baby, as it is on the mom. And yet you look at also then someone who is not stressed at all while they're pregnant, is in a very happy relationship, happy with their life, have good moral support, and you look at those babies that come out, and they have seen a marked difference in the IQs of those babies versus babies whose mothers were stressed during pregnancy at about the elementary school age, and noticing that there is quite a difference between the two groups. So what is it about being in the womb that predisposes you to stuff? Well, it's all the stuff that your mom is going through. It's the combination of your mother's environment, it's the combination of your mother's genetics, and all that gets pulled into you while you're in the womb. And then when you're born, it's all of your environmental factors plus your genetic factors, and all this combines to really culminate in that first year of life, where your brain will learn the most it will ever learn in that first year of life. So Dr. Foster Cline speaks a lot about this first year of life and what happens to a baby's brain in that first year of life that sets them up for failure or success. So Dr. Foster Cline, phenomenal psychiatrist who really studied attachment disorders in children who were unattached. So really the far extreme of those children who had experienced what you would call nowadays adverse childhood experiences. And in his book, Hope for High Risk and Rage-Filled Children, he talks about this first year of life and the cycles and how that bond and attachment forms between the baby and the primary caregiver. And he talks about how that bond and that attachment is really made between a child who is completely helpless and then has a parent or an adult who appears to be controlling, thus in control, and authoritative, and can come in and solve all of their problems. So let's take an example, because that can sound kind of extreme. You look at a baby, especially a newborn baby, cannot even lift their head, cannot even roll over in bed. And so they wake up and they're really hungry. And they have no way of lifting their head, they have no way of walking to the refrigerator. You would describe them as perfectly helpless. All they can do is open up their mouth and cry. So that's what they do. They start crying. So mom or dad, whoever comes over, and what do? They pick up the child. So here in the child's mind, they are completely helpless. They have a need that they cannot fill themselves. And here is someone, wonderful someone, who comes in and rescues them and fills their need. Whatever it may be, wet diaper, hungry stomach, whatever. And it's this kind of picture of a person who's helpless, and then you can almost describe it as a savior who comes in and saves this helpless baby. Reminds me of the scene in Sense and Sensibility, where she has she has sprained her ankle, rolling down the hill, having fun, and she's completely helpless out there in this field, and it's of course raining just for dramatic effect. And from the top of the ridge, here comes this very handsome guy on a horse, and he looks down and he sees this helpless woman with a sprained ankle, and he jumps off the horse in the most dramatic manner that he possibly can for Hollywood, and he runs down the hill and he scoops her up and takes her up to the horse and takes her home. She, in that movie, was completely bonded to him after that. Same thing with the babies. You come in and you feel a need that they are helpless to fill themselves, and that is where that bond and that attachment start to form. As a side note, it's very interesting to see that children who have parents who are abusive still do better in life than if a child is neglected. Because at least they have that parent who sometimes, maybe inconsistently, but sometimes will come and fill that need, rather than having a child who never ever has their needs filled. And they lay there, especially in some of our orphanages worldwide, for days with hungry stomachs, wet diapers, you name it. So that bond, that feelingness of being helpless and having someone come and fill your need is crucial for that bond and that attachment to occur. So as we talk about bond and attachment, we look at some of the more work that Bruce Perry did in his research, showing how our brains are structured, are wired for bonding and attachment. All of our hormones, the way that the mothers naturally respond to the baby because of the hormones like oxytocin that come out when you're pregnant and just had your baby, and that's flowing, and that naturally makes the mother and the baby bond together. You see that especially like when the mother starts to breastfeed the child, and you see them looking in each other's eyes and having the baby getting its needs met at the time with mom there. And those building blocks, the mother-child relationship in those moments, are what is the foundation for all that child's future relationships in life. So really, it's that first year of life that your foundation is laid for understanding of the world. Is the world a generally safe place where you feel secure, where you know that people will be there, that you know that people care for you, that you can trust people? Or is the understanding that you walk away with in that first year of the world is a scary place. I'm on my own because I cannot trust anybody. And so I've got to do it all by myself. I have to be in control, even though I'm a 1-year-old or a 2-year-old, because nobody has been there to care for me. And so I need to take care of myself. So as we look at some of this, we see the child growing up through the first year and forming their relationship foundation and sort of being enthroned. I mean, really to be waited upon by, 2 parents, have all of your needs met all the time. Whatever you want, it's done. All you have to do is just scream loud enough or long enough and all of your needs are met. Quite the life. And then comes the harsh reality when they become about 2 years old and they get their first no from a parent. They are hungry and mom says, no, you have to wait an hour for dinner. Whoa, they've never heard that before. It was always before just the automatic, yes, of course, here's some food. Or they go to play with something, like the electrical circuit, and mom says no. Whoa, they've never heard that before. So year 2 is really about setting limits and boundaries and teaching them that in this relationship where they trust the parents because they have met their needs, there also comes with that boundaries and authority. And that those same parents who rescued them before are the same parents that protect them from current danger. And as we see children coming out of that first year of life, really by that point, their course is set as far as whether they will be a joy to be around and accept limits in their relationship with their parents, or if they are already not so fun to be around because they cannot accept limits, or because they are not bonded and don't want to trust. So that is really where it all begins.